Bivalirudin, Argatroban, and Dabigatran are the drugs for today, and they are direct thrombin inhibitors, DTIs for short. And we are at day 5 of our pharmacology series. Now, to understand this better, let's take a look at the coagulation cascade, which is a process taking place in the body to give us fibrin. Now, let's backtrack a bit. From our previous videos, I mentioned that platelets aggregate or clump together to form clots to prevent or stop bleeding. Now, the clot which is formed from platelets is a temporary clot or plug, which is not permanent and is not stabilized. So, the fibrin from the coagulation cascade forms a mesh which covers the clot formed by the platelets to stabilize it and make it more permanent. Now let's take a look at the coagulation cascade, well, a section of it. So factor 10 is activated to become activated factor 10, which converts prothrombin into thrombin. Let that sink in a bit. Now thrombin converts fibrinogen into fibrin, which forms a fibrin mesh which we need to cover and stabilize the clot formed from the platelets to make it into a more permanent clot. Now direct thrombin inhibitors like bivalirudin, argatroban, and dabigatran inhibit thrombin, which means that fibrinogen will not be able to be converted into fibrin, so we will not be able to get that fibrin mesh to cover the clot formed by the platelets. So these drugs have an increased risk for bleeding, and that is why